Europe's response thus far has been fairly mixed. We have Italy introducing travel restrictions. Other countries have decided not to go that way. What is your assessment of the correct response that Europe should be pushing forward with here?
Well, thank you very much for the opportunity to share the latest updates that we have on this situation. Of course, as you know, it's an evolving situation and one that we're monitoring very closely. I had the opportunity to meet today with the director of the European Centre for Disease Prevention and Control, where I received the latest information concerning the member states. At the moment, the situation in the member states is affecting 6 member states, but in terms of the number of cases, as you said, it is still on the low side. Of course, this is something that we need to be very, very vigilant about, but we are in coordination with all the health ministers of the member states, ensuring that all member states have the plans in place in case there is a case of coronavirus. And we have also ensured that the level of preparedness, speaking with all the ministers, is quite high. What I would like to share with you is that we need at this stage to be guided by the facts and the science and not fear. It is a situation that is constantly changing, but WHO and the European Centre for Disease Prevention and Control are very closely following it, and all European member states have very well organized health systems, and as the situation stands now, are able to react and respond very effectively.
Commissioner, do you think travel restrictions at this point are necessary? Some countries, Italy, have decided to go that way. The United States has certainly gone that way. Do you think restrictions are required? Do you think they would be effective?
WHO and the ECDC have not recommended travel restrictions, and we support the position taken by the World Health Organization. I'm aware that Italy has moved in this direction, but we are following exactly what the guidelines of WHO and ECDC are providing to us.
Commissioner, you've made €10 million available in order to try to combat the effects of the coronavirus. How do you plan to divvy up that €10 million?
I'm not absolutely sure I heard your question correctly. Could you repeat it?
What will you do with the €10 million you have made available to combat the effects of the coronavirus?
We have made that amount of money available in order to encourage research into the finding a vaccine and looking at the details of the coronavirus. As you know, it is something that is not available at present, and we as the EU want to provide all the help necessary in order to move forward with the research needed and hopefully to find a vaccine as soon as possible.
How much can you dictate to countries what they need to do regarding this? How much do you have control over their health systems?
The Commission and we have a coordinating role in terms of member states. As you know, the public health systems are member states' competence, but we have a coordinating role. I have personally spoken to all the health ministers where cases of coronavirus have been detected in their member states, and we are able to facilitate this coordination and also be available in case they need any extra support from us. I would also like to say that we as the EU would reach out globally for any support requested if asked.
Okay. Commissioner, the Chinese have decided to fast-track a Gilead antiviral drug. They've decided that this is a therapy that is in no way anywhere around the world currently having regulatory clearance, but they're going to fast-track that. What approach will Europe take to this antiviral? Do you think we should look to maybe fast-track drugs in these kinds of instances?
as you know, the European Medicinal Authority are those that are responsible to see what drugs are available within the member states. And if there is any development, I'm sure that they will look into it. We need to always be aware when you have an evolving situation that you need to look at all the precautions taken. And I'm sure that the EMA will be looking at this too.
What is your assessment more broadly, Commissioner, of the Chinese response thus far to the coronavirus?
We have no indication that the Chinese have not been helpful and positive in terms of the coronavirus. This is also the opinion shared yesterday that I had a conversation with the director of WHO, and ECDC, the European Centre for Disease Prevention and Control, today told us that they're in very, very close communication with the Chinese authorities and are exchanging information and receiving any help that has been requested.
Commissioner, how difficult is it for there to be an ultimate arbiter here, given there are so many global and international agencies involved? You've just mentioned two of them in your last sentence, and that's not even counting each individual country's health system and the European Commission health system.
I think what we need to understand here, that when we have to deal with a situation as we have now, first of all, we need to be very coordinated, to have close cooperation. And I can assure you that this is happening at EU member state level, where member states are in very close coordination, cooperation, exchanging information, good practice, and seeing where there are difficulties and how one can support the other. And this goes beyond the member states to a global level. It is a very evolving situation, so we are monitoring it very closely. There are differences between what some member states are facing, but so far I think the level of cooperation, from at least my information, is extremely satisfactory.
Commissioner, what are your priorities beyond the coronavirus right now, given the amount of turmoil there is in the European Union more broadly, and obviously the situation with Britain?
Well, the coronavirus, I would say, is our priority at present, but it was not a priority at the beginning of the mandate because we did not know that it was going to appear. Tomorrow we have the launching of the consultation phase of the Europe Beating Cancer Plan. This is a priority for this Commission. It is the beginning of a consultation with all stakeholders, organizations, patients, and member states, so that by the end of 2020 we are able to put forward a plan that will be able to address cancer at the European level, from the very beginning of the journey to prevention and diagnosis, going on to survivorship, palliative care, and also looking at research and innovation. So this is the launch that we are having tomorrow as a Commission in the European Parliament in Brussels.
Okay. Commissioner, we look forward to hearing exactly what is said tomorrow. But as you say, the coronavirus is the priority right now. In the more medium term, do you think European drug companies should be encouraged to be more active in dealing with the threats that global pandemics pose? At the moment, there is no economic incentive to get these companies involved. Do you think there should be tax breaks? Do you think there should be some sort of public service mandate for European drug companies? How should we approach this?
This is a very important issue that you're raising, and really there isn't one quick answer that one could give. What I can tell you that it is one of my priorities to look at all the pharmaceutical strategy within the European Union member states and to come up with a proposal that will allow affordability and accessibility to medicines by the end of the current year. So there are many different aspects to this that we need to look at. Which involve innovation and research at the European level.